हॅलो, शिकलकर सर, ऐकायला येतं का? हॅलो.
Yes, sir. You are audible, sir.
व्हिडिओ क्लीन दिसतो क्लिअर?
Yes, sir. Video is clear.
हा, मग ते काही चेक करायचं आहे का व्हिडिओ?
सर तुम्ही एकदा स्क्रीन शेअर करता का पीपीटीची?
हा, करतो.
हो सर एकदा शेअर करून पाहूया आपण.
हो, नाही काय प्रॉब्लेम नाही, मला माहिती आहे, तरी पण चेक करूया की. ओके, दिसते का? स्क्रीन दिसते? स्क्रीन दिसते का सर?
Yes, sir. Yes.
दिसते ना?
हो सर, क्लिअर.
जस्ट अ मिनिट वेट करा, स्लाइड शो करतो. बघा शिकलकर सर.
स्क्रीन दिसते.
हा, ओके.
स्लाइड शो चालू होतोय.
ओके सर.
ओके.
आता हे करू?
येस सर.
बंद करू?
येस सर. येस.
ओके, व्हिडिओ क्लिअर आहे?
व्हिडिओ क्लिअर आहे सर.
ऑडिओ
इज ऑल्सो क्लिअर सर.
ओके, नो प्रॉब्लेम. ओके, पण चेकअप करणं चांगलं कधी ना.
रवी सर.
शिकलकर सर.
रवी सर, शिकलकर सर बोलतो.
सर शिकलकर सर, तुमचा वॉइस थोडा क्लिअर नाहीये.
क्लिअर नाहीये. रवी सर.
येस. नाव यू आर क्लिअर सर.
आवाज येतोय क्लिअर?
हो सर, यू आर क्लिअर.
ओके सर.
हॅलो. ठीक मी आहे.
तर बघा आलं का मग अनम्यूट झालं ना? हां, गुड मॉर्निंग दळवी सर.
Sir, we'll start in another 5 minutes.
Yes, okay, no problem.
We will be starting exactly at 11:30. Good morning, everyone. A very warm welcome to online national seminar on impact of COVID-19 on India, health, tourism, agriculture, and geopolitics, organized by IQAC and Department of Social Sciences, Rajaram College, Kolhapur. I am Dr. Ruchikesh Dalvi, and I'm going to moderate today's sessions. The impact of pandemic COVID-19 has created a new paradigm, not only for India, but the entire world. The pandemic has affected every aspect of human existence. Consistent efforts are being made all over the world to overcome societal, economic, and emotional challenge born out of the COVID crisis. It cannot be overemphasized that governmental and institutional efforts to counter the spread of COVID-19 can bear fruits only if citizens too undertake informed action. Well, it is said that knowledge empowers to shape the situation, ignorance empowers the situation to shape you. And therefore, it is very important to educate ourselves every day and learn something new. With this very purpose in our heart, we at Rajaram College have been organizing a series of online seminars since the outbreak of pandemic COVID-19 to highlight various issues that would empower participants to mitigate and adapt to the evolving situation. Keeping the same spirit, in the next 2 days, we are going to ponder on how pandemic COVID-19 is affecting health, tourism, and agriculture in India. We are also going to look into geopolitical circumstances emerging out of COVID-19 crisis. And to help us understand these crucial issues, we are going to have eminent experts with us. Today, in the first session, Professor Dr. P.S. Kamble sir will speak on impact of COVID-19 on health. In the second section, Dr. D.H. Pawar sir will throw light on impact of COVID-19 on Indian tourism. Tomorrow, in the third session of the conference, Principal Dr. A.S. Khemnar will enlighten us on organic farming, the global demand. And in the fourth session, Dr. Prakash Pawar sir will talk on India's geopolitical perspective. So basically, we have a multi-cuisine intellectual feast laid out for us. I am sure we all are going to get immensely benefited by this seminar. Now, we start with the proceedings. To begin with, may I now request Head of the Geography Department, Dr. K. Mali sir, to introduce idea behind the seminar and welcome the guest. Mali sir, please.
हां ठीक आहे. मी बघतो मी मीटिंगमध्ये.
Good morning to everybody and welcome all of you. Myself, Dr. K. Mali, Head of the Department of Geography and Organizing Secretary of this today's National Seminar. First of all, I welcome to you in this seminar. IQAC and Department of Social Sciences, Rajaram College, Kolhapur has been organized this today's National Seminar on the topic of COVID-19, impact of COVID-19, impact of COVID-19 on India in the sectors of health, tourism, agriculture, and geopolitical issues. Do you know today the whole world has been facing the coronavirus pandemic epidemic and the different problems created it. Its impact is shown on the different sectors. In India, also facing this same problem of the COVID-19 pandemic, and it has been largely disruptive. Mainly the impact has been shown on the Indian economy, Indian agriculture, industries, transport, health, tourism, and education, and other different social issues. So that our college has been organized this today's national seminar on this major issue. In this seminar, today, 13th June, there are two sessions, and the first session is on the impact of COVID-19 on the health, and Dr. P.S. Kamble sir, Professor of Economics Department, Shivaji University, Kolhapur, has been delivered the lecture. I heartily welcomes this Kamble sir. Second session is on the impact of COVID-19 on tourism, and resource person is Dr. D.H. Pawar sir, Assistant Professor of Geography Department, Shivaji University, Kolhapur. I also welcome to this Dr. D.H. Pawar sir. And tomorrow, on 1st July, there will be 2 sessions. First session is on the topic of organic farming, the global demand, and our respected principal sir, Dr. S. Kemnar sir, delivered the lecture on this important topic. Then second session will be held on the topic of India geopolitical perspectives, and lecture delivered by Dr. P. Pawar sir, Professor, Department of Political Science, Shivaji University, Kolhapur. I request all the participants to attend all the 4 sessions and get the important knowledge and give the feedback of these sessions. Once again, I have welcomes to all participants and resource persons in this today's seminar. Thank you.
Thank you so much, sir. Now, I request Head of the Economics Department, Dr. T.K. Udgirkar, sir, to introduce our first speaker, Professor Dr. P.S. Kamble, sir. Udgirkar, sir, please.
Good morning, one and all. I am here to introduce today's resource person, Professor Dr. P.S. Kamble, sir. He is working as a professor, Department of Economics, Shivaji University, Kolhapur. He has more than 31 years teaching experience. His research specialization is environmental and resource economics and public finance. He is a research guide. Under his guidance, 30 students of MPhil and 11 students of PhD completed their research. He has published more than 180 research papers published in journals. Out of 46 at international level, out of 87 at national level, out of 48 state level. He has presented more than 200 research paper in our conference and seminars. Sir has completed 2 major research projects. Sir has written 19 books, edited 10. Sir has received 6 awards for best research paper. He is working as a director, chairman, member of various committees. Sir has visited Japan and Malaysia. Thank you very much.
Thank you so much, sir. Now, before we start with the session, few routine instructions. All the attendees are muted to minimize the background noise. So if there are any questions, please type them in the chat box on the Zoom or YouTube Live respectively. We are going to direct these questions to our resource person at the end of talk. I would also like to point out that there will be a brief feedback survey at the end of the seminar. Links for the same would be provided in the chat section and also on the Telegram group. Participants are requested to fill up the feedback form. The participation certificate would be issued to only those participants who have attended all the sessions of the seminar and have filled up the feedback form. Now, I request respected Dr. P.S. Kamble, sir, to address the participants. Kamble, sir, please.
Okay. Good morning, one and all. Am I audible and visible as well? Dalvi, sir, am I audible?
Yes, sir. Yes, sir. You are audible.
Okay. Good morning, one and all. At the very outset, I am very much thankful to Rajaram College for providing me an opportunity to deliver a lecture on COVID-19 impact on health. I am very much thankful to Principal Dr. Kemnar, sir, I'm also thankful to IQAC coordinator, Mrs. Satar Madam. I must thank Head of the Department, Dr. Udgirkar sir, Member of the Department of Economics, Dr. Hemant Katre sir, the faculty which is moderating today's session, Dr. Dalvi sir, the seminar introduced by Dr. Mali sir, all other members and friends in the Rajaram College, dear participants, students, and fellow delegates. Really, it's a proud and privilege for me to deliver a lecture on the impact of COVID-19 on health. Once again, I'm very much thankful to one and all who were so much instrumental in bringing about my lecture before the audience and before the staff as well. So far as my lecture is concerned, I will begin with what is the need for studying health or importance of health. Number two, there is a misconception about what health is, and there are different perspectives in which health is looked at, and how it is misconception, what should be our perspective, what should be our approach looking towards the health, that I will try to explain. Then I will try to explain where India stands in the globe. So far as the health sector is concerned, health status is concerned, I will make a comparison of health of India, health sector of India, with some of the countries in the world, and where India is standing now, where India is, that I will try to analyze before you. Then I will try to place before you what is health status of India, what health status is, what is the status of health of India. Then I will switch over to the trends in COVID-19 infection cases, because it has certain policy implications. It has certain peculiarities and policy guidelines. And therefore, I will try to place before you what trends are there and what are salient features, what are salient peculiarities, those are there. Then I will move on how this COVID-19 pandemic is affecting health sector of India, how it is affecting, whether it is favorable or unfavorable, to what extent, what is the magnitude, what is the intensity, all those things and details that I will try to place before you. Then I will switch over to what efforts are being made by the government so far as contamination or overcoming the situation of COVID-19 crisis with regard to health sector in respect of health sector. And lastly, I will try to place before you what should be a direction of policy of the government directed towards combating the adverse impact on health sector of India, society of India that is taking place, and what should be the policy, what should be the policy guidelines. Those are helpful for us so far as the adverse effect of COVID-19 pandemic on health sector is concerned. Thus, in all, in 4 to 5 sections, I will stick up to my lecture, and now I am beginning my lecture. Can I share my screen? Can I share my screen?
Yes, sir. Please share your screen.
Yes, yes. Okay. Is it audible? Is it visible? Screen is visible? Dalvi sir?
Yes, sir. Screen is visible now, sir.
Okay, okay. As I have mentioned that, my lecture is divided into 4 to 5 sections. Importance of health, what theory of economics talks about health, then what is the health scenario of India in comparison with the world or global scenario, then health status of India, what status of health is there, then trends in COVID-19 cases, impact on health sector of India, then major conclusions and policy directions or measures which will be helpful so far as dealing with the impact of COVID-19 on health is concerned. Now, talking about what is the importance of health. So first of all, importance of health is health is a central happiness of human beings and well-being. Unless and until you are healthy, you cannot be happy. You cannot be in a good well-being condition. And for that reason, health is of crucial importance. Health is of very much importance. Now, health makes very important contribution to economic progress. And unless and until health is good of the people or of the population, economic progress cannot be contributed. It cannot be contributed. In addition to that, the healthy population can live for a longer period and it will be more productive and it will be more helpful in speeding up the process of economic growth of the economy. This tries to tell us how health is very much important, what role health can play so far as economic development and other perspective or other dimensions to be taken into account. Now, in addition to that, Mahatma Gandhi ji talks about what is importance of health. And he says it is health that is real wealth and not pieces of gold and silver. That more talks about how health is very much important, how health is very much significant, that is there. Then Emerson is a foreign thinker. He describes importance of health as the first wealth is health. We say health is wealth. Emerson says first health is wealth. First wealth is health. That is, health is the first wealth of a person or an individual that is there. Then Jefferson talks about importance of health. Our greatest happiness doesn't depend on the condition of in which the chance has been placed us, but is always the result of good conscience and good health. Good health is important. Then Ditton is a Nobel laureate in economics, and this Ditton talks about what is importance of health. He says growth doesn't bring any automatic improvement in the health. Component of well-being is very much important. That is, Ditton of the opinion that unless and until the efforts are being made, we are not in a position to realize that status of health, that level of health, which is expected and desirable. It is just growth is not sufficient or that cannot bring about the positive impact on the health. Purposeful efforts are required. That is what Ditton talks about. Then all of us know again Amartya Sen is a Nobel laureate in economics. He says economic growth without investment in human development is unsustainable. And here human development is health. One of the major aspects of human development, I will speak later on, that is health. It is one of the major dimensions of human development or human resource development is human health. And therefore, he should be admitted or the effort should be made to achieve economic investment or investment in human development, and that is helpful for us in sustainable development of the economy as well as ethic or morality in the development that can be also brought about. In addition to that, Lord Buddha talks about to keep the body in good health is a duty. Otherwise, we should not be in a position to keep our mind strong and clear. All these quotations, all these paraphrases, all these statements that abundantly explain how health is important, how health is very important. Now I am trying to explain what is the significance of health in theory. Now our perspective looking towards the health is nowadays it is faulty, it is incorrect. It is a misconception looking towards the health. And therefore, what theory talks about, especially economics theory, talks about health, that I want to explain. Because that gives a clear-cut idea what should be the government perspective, what should be the perspective of the government looking toward the health sector, healthcare services, health infrastructure, and health facilities to be provided to the people or citizens of that particular country. In this backdrop, when we try to take into account what is the theory of health, we found that all wants of the people are classified into two categories. One is known as private wants, and another is known as public wants. That is, wants which are felt at individual level or private wants, and wants which are felt collectively are known as public wants or social wants. And based on that, commodities are classified into two categories: private goods and public or social goods. The commodities and services which satisfy private wants of the people are known as private goods and services. And the commodities and services which satisfy public or social wants of the people of the society, they are known as public goods and services. Here, what is important is health is a public good or service. Health is a public good or service. Then what are the peculiarities or characteristics of public goods or health as a public good or service? Number one is that health satisfies only public or social wants. What does this mean? This means everybody wants health facility. This means everybody requires health facility, and that facility is necessary to be provided because health is a social commodity, health is a social service, and it satisfies social want or public want of the people, and therefore the health has a duty and responsibility. It tries to discharge the duty and responsibility of satisfying public wants of the people. Therefore, it is a public good. Secondly, joint consumption. Many of the people, crores of the people, lakhs of the people at a time can derive benefits of health as a social service, healthcare as a social service or public commodity. Then market failure, the prices of health services cannot be determined. Demand supply forces, we call it as a market mechanism. We describe it as a price mechanism, is not in a position to determine prices of health services or health goods because it is a public commodity or public service. It is therefore market is not in a position to determine prices of the health services based on the demand supply interactions or interactions between the demand and supply of the health facilities, and therefore it should be considered as a peculiarity of health as a social commodity. Then the benefits of health services cannot be divided. Benefits of health services, that we cannot say I benefited this much from the health services being provided by the government. I benefited this amount from the health services which are provided. We cannot say that, and therefore it is known as indivisibility of benefits. Benefits from the health services, benefits from the health sector cannot be divided into small parts, into small pieces. Then no exclusion. Health services cannot be excluded to the people who are poor section of the society, who are socially deprived communities in this society, because health is a social service, health is a public good, and it is therefore social exclusion and discrimination is not possible so far as theory of health sector or health services or healthcare service is to be taken into account. And lastly, when it is a social service, when it is a public service, when it is a social commodity, when it's a public commodity, it becomes the sole responsibility of the government. It becomes the prominent responsibility of the government to provide for health services to the people of that nation, to the citizens of that nation, to people of that society. And it is therefore that also requires to be taken into consideration so far as the theory of health in economics or theoretical background of health in economics is concerned. That is, health is a social commodity. Health is a public service and it is not a private commodity or private service. And that perspective should be there, looking towards the health sector and healthcare services, health facilities which are being provided. That is the background, that is the foundation on which health sector should be dependent, health sector should be developed, that is there. Now, moving towards the next section, what is the scenario of India's health sector in comparison with some of the countries in the world? That tries to place before us what is the place of India so far as the health sector is concerned in the globe as a whole. And that brings about what weaknesses are there, what shortcomings are there, what strengths are there, what weaknesses are there in the health sector of India compared to some of the countries or compared to the countries from the globe or world. When I am talking about health, that is health sector. And health sector comprises of health infrastructure. Health sector means healthcare services. And healthcare services, number of healthcare services are there, number of health infrastructure is there, and the sum totality of that is known as health sector. I will make a comparison of India's health sector, India's healthcare services, India's health infrastructure with some of the countries in the globe, with some of the countries in the from the world, and that will give us an answer. Where does India stand in the world in health sector? Where we are, where India is. So far as the health sector is taken into account in the well, and that answer is described by this analysis. Now, number one, this talks about health risk index. And health risk index tries to show what is the level of India in comparison with the health facilities and health sector has been developed in the world. And it is found that in 2019, this report is for 2019, and the report of 2019, it is relating to 100 countries. And relating to 100 countries, we found that we are at the position of more than 75. In the countries of 100, we are in the rank of 75 in the total number of countries 100. In 2019, Spain ranks first, Italy stood second, Iceland stood third, Japan stood fourth, and Switzerland stood fifth. We stood more than 75 in the total countries which were included under the health risk index. Health risk index. Now, so far as health is concerned, there are 50 top countries which are dominant and prominent in the health sector. Their health sector is prominently advanced, prominently developed, and in these top 50 countries, Iceland, Luxembourg, Sweden, Switzerland, Spain, Italy, Israel, Australia, these are the prominent countries which are topmost in 50 so far as health is concerned. Now, the healthiest 3 countries in the world, highly developed, highly advanced health sector in the world is Spain, Italy, and Iceland. Spain, number 1, Italy, number 2, and Iceland, number 3. These are the 3 prominent countries. So far as advanced health sector or health sector and advanced or advancement is to be considered, is to be taken into account. Now, health is a very important component of human resource development. And all of us know human resource development is a measure of what is the magnitude and extent in which the development of human resources has been taken place. And human resources plays a very important role in growth and development of any economy. In this backdrop, while analyzing health sector of India, while analyzing what is the status of health sector in India, it will be also logical to consider what is the position of India's human resource development. Human Development Index is being developed by World Development Bank, and these are the 5 countries these are the 5 countries who are top in the human resource development. Norway, Switzerland, then Ireland, Germany, and Hong Kong. And India stands at 137 rank. Now, these are the global level comparison. Suppose neighborhood countries, our comparison is made with the neighborhood countries. That also gives us an idea where India is so far as the human resource development in India is to be considered, is to be taken into account. Take example, our rank is 129. Sri Lanka is ahead, so much ahead in human resource development. We stood at 71 rank. Then all others, Pakistan is behind to us, then Bangladesh is behind to us, but Sri Lanka is very much ahead to us so far as human resource development. And all these are neighboring countries, all these are underdeveloped countries or developing countries. Now, supplementary to that, when we talk about human resource development, prominently, three indicators are taken into account. One is life expectancy at birth, then expected years of schooling, and GNP, gross national income per capita. As we are talking about only health, just life expectancy is taken into account. That also gives us a clear idea that what is life expectancy of India compared to these are South Asian countries. These are South Asian countries. Our life expectancy is 69 years. Arab states, it is more than 71 years. East Asia and Pacific, it is about 75 years. Europe and Central Asia, it is more than 73 years. Latin America and Caribbean countries, it is 76 years. South Asia, 69 years, more than 69. And Sub-Saharan Africa, it is 60 years, more than 60. That talks about what is the life expectancy of India. And I'm not touching upon other indicators, that is expected years of schooling and GNP per capita. It is also comparatively lesser when we try to take into account the desirable figures. Now, in the human resource development, what is important is these are the change in rank in human resource development that taken place of India. Take example, in 2017, we were at 130 rank. And in 2018, we switched over to 129 rank. Brazil was on 79, China was on 86, Russia was on 49, South Africa was 103, and their rank has not been changed. What peculiarity is between 2017 to 18, no change in rank has taken place, and we are so much lagging, we are so much behind so far as our rank in the human resource development is concerned. And Sri Lanka is so much ahead. In 2017, it was at 76 rank, and in 2018, it was at 71. Improvement is found. And how, again, Maldives, a very small Iceland, Maldives is at 101 and 104. This also talks about how we are lagging in human resource development, and health is very important component, very important part of human resource development. Now, this talks about our comparison with some of the countries. Those are prominently Asian countries, so far as life expectancy is concerned. With the majority of the countries, life expectancy of ours is comparatively lower. Take example, Bhutan is there, then Nepal is there, Sri Lanka is there, again Bangladesh is there. Their life expectancy is more or greater than us. That is also necessary to be taken into consideration. Now, this talks about how much we spend on health. And when we try to make a comparison of health expenditure in India with some of the countries in the world, it is found that America is the costlier country in which expenditure on health is significantly greater. It is significantly highest, which is followed by Switzerland, Germany, then Sweden, France. Ours is just $267. China is spending $731. A lot of difference is there, more than double. This also talks about we are not so much cautious. We are not so much sincere, rigorous, and honest so far as health services or health sector development is concerned. And that is also identified when we try to take into account the expenditure on health across the countries in the globe is to be taken into account. Now, this is very important. This talks about how much we are spending on health as percentage of GDP and what's its component. Now, in India, total expenditure on health is just 4% of gross domestic product. 4% of gross domestic product. China is spending 4.4%. China is spending 5.4%. Sri Lanka is spending equal to us 4%. Egypt is spending 5%. Indonesia a little bit lower. Philippines is also spending 4%. But what is important is of the total expenditure on health as a proportion of GDP, government expenditure is 0.9%. That is very important. Fiscal expenditure on health, that is public expenditure on health, is just 0.9%. It is 3.2% in China. It is higher in Sri Lanka, 2%. It is Indonesia, 1%. Egypt, 1%. Philippines, more than 1%. But we are spending 0.90%. That is public expenditure. That also talks about how much we are spending, especially government is spending on health. Now, of this expenditure, out-of-pocket expenditure is more for us. It is 64%. That is, that person, that citizen, that individual has to spend more to get health facilities, to get healthcare facilities, and that proportion is 64%. That proportion is 64%. It is very lower in China, 36%. It is lower in other countries. It is lower in other countries. Take example in Sri Lanka, it is 50%. In Indonesia, 60%. That is, our people request to spend 60% from their own pocket. That is also peculiarity. This talks about how the mortality rate is higher. How mortality rate is higher of ours in comparison with the other some of the countries, and that is also necessary to be taken into account. This indicator is very important. It is known as DALI. DALI is a full form of disability adjusted life years. DALI is an indicator that measures loss of years because of sickness and deaths, earlier deaths, immature deaths. And for India, it is significantly higher, 34,000 to 1 lakh population. DALI, disability adjusted life years. It is significantly higher for India, that is 34,000 to 1 lakh population. It is lower in other countries. China is there, Sri Lanka is there, Indonesia is there, Egypt is there. What does this mean? This means that health sector of India is underdeveloped or it is less developed. To the extent desirable, to the extent required, health sector has not been developed in India. It has not been developed in the country like us, in the economy like us. That is the peculiarity that is necessary to be taken into account. So far as the scenario of health sector of India in the globe, or in comparison with some of the countries in the globe, that is there. Now, already in the theoretical part, I have tried to explain before you that health is a public good or public service. And one of the peculiarities, one of the salient features, one of the properties of public good or social good is it is the sole responsibility of the government to provide that service, that commodity. In this backdrop, I am trying to explain before you, I am trying to analyze before you how the government is being giving, or government gives a treatment to the health sector of India, to the healthcare services in India, that is there. And therefore, in this part of my lecture, I will try to explain before you what expenditure government is spending on health, what is the availability of the health infrastructure in India, whether it is adequate, whether it is inadequate, it is sufficient, insufficient, not sufficient. That I will try to place before you. What is status of health of people? What is status Indian people have? And in this backdrop, that will place before us adequacy and inadequacy of either expenditure in health infrastructure, health status, and that I am trying to place before you, taking into account some of the indicators. Some of the parameters I am taking into account, and based on that, I am trying to analyze how expenditure is being done or incurred by the government, what availability of the health infrastructure is there in India. What is the status of health of people in India? That is there. Now, first of all, expenditure of the government on health. Now, number one, when we try to take into account health expenditure as a percentage of gross domestic product, it is found that India is spending 5% of GDP on health, and that comprises of private expenditure and public expenditure. Private expenditure, public expenditure, total expenditure on health in India is 5% of GDP. Of China, it is 4.7%. Of Thailand, it is 3.4%. Brazil is significantly higher. It is about 9% of GDP. Then Japan is also higher. It is 8.2%. America is 15.2%. So we are at 5%. This is not sufficient. What is important is, of the total expenditure on health, when it is segregated, when it is divided from public expenditure and private expenditure, or the total expenditure on health, when we divide into public expenditure and private expenditure, that is very much alarming for us. That is very much alarming for us. In foreign countries, this expenditure is incurred on health, and India, we are spending this one. Of that, just 30% is government expenditure. Of the total expenditure on health, 30% is public expenditure, government expenditure, and 70% is private expenditure. That is, our health expenditure is dominated by the private expenditure than the public or government expenditure. Even health is a public good, or health is a public service or social service, social good, that is there. Now, this talks about what is the availability of physicians in India. And this availability of physicians is to 1,000 population. And a little bit comparison I am trying to make, so that where we are, that can be identified, that can be recognized. Take example, in America, it is 26 physicians to 1,000 population. In Japan, it is 21 to 1,000 population. In Saudi Arabia, it is 14. In Brazil, it is 12. In India, it is just 6 to 1,000 population. You can calculate to 100, and 100 comes at 0.06. Just insignificant. Just insignificant. That is availability of the doctors, availability of the physicians. To 100 population, in India, is just 0.06. It is for 1,000. It is for 1,000. Then the proportion of private and public expenditure, that is very important, because theoretically, health is a public commodity, health is a social service, and therefore public expenditure, government expenditure plays a very important role in providing health services by the government. And in this backdrop, there is a need for examining whether the government is shouldering that responsibility of providing social services or public services in the form of healthcare services to the people or to the society of India. In that backdrop, the breakup of total expenditure on health divided into private expenditure and public expenditure is taken into account. That gives a very dismal scenario that places before us a very unsatisfactory picture in the country like us. Take example, in India, of the total expenditure on health, 81% is private. 81% is private expenditure. And just 19% is public, that is government expenditure. In the case of other countries, take example China. China has a 61% private expenditure and 39% government expenditure. Thailand, 36% private expenditure and 64% public expenditure. Take example, America. America is a capitalist economy. All of us know. America is a capitalist economy. Japan is a capitalist economy. And in these economies, actually, there should not be more existence of public expenditure or government expenditure, but the scenario is reverse. When we try to make a comparison of the breakup of expenditure on health into private and public expenditure compared to India. In India, it is 81% private expenditure and 19% public expenditure. In America, 54% private expenditure and 41% public expenditure. Japan is also capitalist economy. In Japan, private expenditure is just 18%. And public expenditure on health is 82%. 82%. And reverse position is there, opposite situation is there. So far as total expenditure on health is concerned, and it makes a difference so far as growth and development of health sector on the one hand, and health care services to be provided basically to the poor section of the society, to the workers, to the socio-economically deprived communities in the country like us, that makes a difference. And this is adequately proved that our health expenditure is dominated by the private expenditure than the public expenditure, and exclusively it is reverse. It is opposite to the theory in economics about health or health services. Now, this is very important. How much it requires to spend out of pocket, that is personal expenditure, and that is also significantly higher in the country like us. In India, we have to spend 94% expenditure from out of pocket, but in China it is 85%. In Japan it is 83%. In Thailand it is 77%. In Malaysia it is 76%. But in America it is a capitalist economy, 24%. In South Africa it is just underdeveloped. It is very much less developed, very backward country in which just 16.5% expenditure is being incurred by the people out of pocket. And we have to, in Brazil, it is just 54%, but we have to spend 94%. It is just a reverse of the theory of health service or health sector, so far as economic theory is to be taken into account. Now, this talks about what is the burden of different diseases or fatality rate of different diseases in India. This again, it's a graphical presentation. Now, what is important is now what role the government is playing. From the very beginning, I am trying to place before you, health is a social commodity. Health is a social service. Health is a public commodity. Health is a public service. And therefore, it becomes a sole responsibility of the government to incur expenditure on providing and growth and development of health sector, on developing health infrastructure, on providing healthcare services. But what actually the government is doing, what actually the government is discharging, what actually the government is endeavoring, that I am trying to place before you, taking into account what government expenditure is being incurred on health. Take example, this shows expenditure on health by the government. Up to 2019, it had fluctuations. In this year, it was good. But after that, especially after January 20 and in the lockdown period, it has a declining trend. Significant difference is there between January 20 and this figure in 2019. A significant fall is observed. And in the post-lockdown period, again a decline is observed. This bar shows. That is, expenditure on the health of the government is not rising continuously. It has a fluctuations, it has a ups and downs. And especially after January 20, it has a declining trend. And further it declined in the post-lockdown period. That is very important. So this is very important. And this table talks about what actually growth is there in the health expenditure and the different components of health expenditure. Now, of the total expenditure on health being incurred by the government of India, It is spent on these components. Health research is there, health and family welfare department is there, national health mission is there, Rashtriya Swasthya Bima Yojana is there, Pradhan Mantri Jan Arogya Yojana is there. Out of that, when the percentage change over the previous year is taken into account, what growth is there compared to the previous year, that is taken into account, that gives us an unsatisfactory situation. That places before us a very dismal performance. In the last column, you can see in the last column, all the indicators that I have shown red are showing dismal performance. Take example, expenditure on health research. In 2019, compared to 18-19, grew at the rate of 13%. But in 19-20, it grew at the rate of 7.7%. That is, decline is there. What is important is expenditure on family welfare. Again, that grew at the rate of 3.8% in the year 2019-20. But previously, it was grown at the rate of 18%. More importantly, all these, that is, National Health Mission, then regulating drugs, and also Rashtriya Swasthya Bima Yojana, they have shown a significant negative growth, minus growth, and that is very much dismal. That is very much alarm. That is very much unsatisfactory. They have shown a negative growth. Just only one scheme is there on which government is focusing, and that is Pradhan Mantri Jan Arogya Yojana. All other expenditures, all expenditures on other components have been grown negatively, and just only Pradhan Mantri Jan Arogya Yojana that has shown a positive growth. That is a peculiarity of the expenditure being incurred by the government of India on health sector, and these are the figures for 2020-21. These are the latest figures. These are the latest figures. Now, this is very important. This talks about how the government of India is spending on the health sector development, on the development of health infrastructure, on providing of healthcare services, on providing of health facilities. And it has two trends. Number one is this blue bar shows absolute rise in expenditure of the government on public health, on health. And this curve shows growth in the expenditure of the government. These absolute terms show there is a rising trend, absolute figures. That is compared to previous year, increase in expenditure by the government is there, but that is not adequate indicator. The adequate indicator, the realistic indicator is what is the magnitude in which, what is the extent in which growth has taken place, change has taken place, and that should be a positive change. In this perspective, when we try to examine growth in the expenditure incurred by the government on health sector or health is to be taken into account, this curve shows it is continuously having a fluctuations, and after 2018-19, it is very meager only. It is very meager only. That is, growth is less than 15%. And recently in 2020-21, it is less than 5%. Growth is less than 5%. That talks about how the government is not sincere. To that extent, attention is not being paid. Even health is a public service. Even it is the sole responsibility of the government to develop health sector, and that growth is an indicator. And this adequately proves that. This adequately tells us that growth in expenditure by the government has a negative growth, has a declining growth. And this declining growth is more after 2018-19 and 2019-20 and 2021, it is less than 5%. Now, this is very important. Again, the breakup for the year 2021 is taken into account of the health expenditure incurred by the government of India, broadly divided into health and family welfare and health research. It is found that Compared to the 2019-20, in 2021, expenditure on health and family welfare grew at the meager rate, marginal rate, very low rate of 3.8%. And health research, it is 7.7%, considerable. But overall growth is less than 4%. Already I have shown in the previous chart. This is less than 4%. That is 3.9%. What does this mean? This means that government of India is decreasing expenditure on health sector. We should not consider only absolute figures. Absolute figures are not adequate for us. In assessing, the duty and responsibility is being shouldered by the government on growth and development of health or health sector. Growth rate is very important, and average growth rate is less than 4%. And that is an indicator that to the extent required, to the extent necessary, government is not paying due attention so far as the health sector development in the country like us is concerned. This actually talks about of the total assigned expenditure, how much change has taken place, how much growth has taken place. And all of us, we can identify that except Ayushman Bharat Yojana, all others, and Pradhan Mantri Swasthya Yojana, all others have a negative trend. All others have a negative trend. That is, our health sector development through public sector is concentrated. It is centralized. It is not diversified. It is not disaggregated. It is just centralized. And it is just centralized in Ayushman Bharat Yojana. It is, we are depending upon solely on Ayushman Bharat Yojana for the growth and development of the health sector of India and healthcare services being provided. And all of us know, higher concentration, more concentration can be an obstacle. It can be harmful. And that is happening in the country like us, that is there. This is very important. What happens, government provides in the budget on different items and different components so far as expenditure, allocation and provision is concerned. But actually it spends less. And that also requires to assess to what extent government is stick up to the actual amount provided in the budget and actual amount spent on providing for the development of that sector. When this is taken into account, we get a picture. From 2010-11 to 14-15, whatever it was provided in the budget, less than that government was spending. In 10-11, it spent 97%, then 91%, in 12-13, 82%, 13-14, 82%, 14-15, 87%. But one thing is satisfactory, that after 15-16, government is spending whatever is provided in the budget, sometimes more than that also. And that also peculiarity. That is, what is a simple expectation? What is a common expectation? Common expectation is whatever is provided in the budget, that should be spent. And in this backdrop, when we try to assess, previously government was not sticked up, but in the recent years, recent 5-6 years, it is sticked up. Whatever is provided, it is being spent by the government. That also requires to be taken into account. Now, this is very important. We have National Health Mission. And under this National Health Mission, targets are there. And what achievement that we have achieved, that is also there. And this gives us an idea about the endeavors of the government, attempts of the government towards realizing that parameter, achieving that achievement, or there is a mismatch, or there is a shortfall that is there. Take example, infant mortality rate. Infant mortality rate, the target was from 2012 to 17, it should be 25. It should be 25. But in 2017, it was 35. That we didn't succeed. We didn't achieve. Actually, target was 25, but our realization was 35. There was a gap of 10. And gap of 10 is higher. It is a infant mortality rate, child mortality rate. Again, maternity mortality rate. Maternity mortality rate, that is death during maternity, death during delivery. Target is 100 to 1 lakh births. And our actual realization was 122. We were more by 22. That we didn't succeed. That is there. Then total fertility rate, our target was 2.1, but we could achieve 2.3. We didn't succeed. What does this mean? This means that whatever targets we have fixed under the National Health Mission, relating to health sector, relating to health development of the Indian society, that we couldn't realize, that we couldn't achieve, that is there. Now, health services in India, already I have mentioned that. Actually, it is a public service, social service. So public sector should be dominant in providing health services. But on the contrary, private sector is dominant in the health sector in India. That is, healthcare services are being provided by the private players, private hospitals, private laboratories, private dispensaries, that is there. And our health sector services are scattered. In private sector, 76% are single hospitals, 21% are small hospitals, 2% are medium hospitals, and 1% is large hospital. That is, we have to exclusively or largely depend upon private sector for getting health services, and that is widely scattered. That is widely scattered. Recently in 2010-11, single hospitals percentage in private sector is 64%. Small hospitals 32%, not much change has taken place. This means that the private sector health services is scattered. Centralized services we didn't get in the private sector also. Then what is the situation in public sector? We can think of that. Now, this talks about we have to spend more from our pocket, out of our pocket. And whatever expenditure Indian citizens or Indian people are spending out of pocket, that is prominently goes to preventive care, medical practitioners, transportation, medical and diagnostic laboratories, medicine, and hospitals. This is a breakup of out of pocket expenditure being incurred by the people in India. Now, I have mentioned that our health sector, public health sector, is exclusively centralized. And this centralization is in Ayushman Bharat Yojana. And what is the success of Ayushman Bharat Yojana? That is necessary to be examined. And when that is taken into account, under Ayushman Bharat Yojana, 19,752 hospitals have been empaneled and 29,572 health and wellness centers have been empaneled. Under this scheme, 1,363 lakh benefits were found, but this is important. Only 63% beneficiaries' claims were paid. That is, 27% people have to make a sacrifice of the expenditure they have done on getting health services, on deriving benefits of health. Already they have derived benefits of health services, but their expenditure didn't reimburse. It did not reimburse. Only 63% reimbursement took place. Again, this also indicates the efficacy of, the efficiency of Ayushman Bharat Yojana, in which our health sector, healthcare services have been centralized, have been concentrated. Now, this talks about absolute increase in health expenditure. But what is important is what is availability of beds, because it has very much concern in the COVID-19 pandemic period. I will explain later on. And that is really unhappy. That is really a very poor performance, very dismal performance. Take example, availability of beds to 1,000 population. In America, it is 3.1%, 3.2 beds, number of beds. Japan, it is 40. Saudi Arabia, it is more than 2. Malaysia, it is about 2. Brazil, more than 2. China, more than 2. And India, 0.7. That is 0.7 availability of bed to 1,000 population. You can convert in terms of 100. Or availability of bed to 100 population. You can convert that. What will be the availability? That is, availability of beds in India is very, very scarce. It's very meager. It's very insignificant. And that is the more important point to which we should pay attention. Now, availability of nurse. The availability of nurse is measured. Its availability in comparison or its ratio to doctors. Its availability to doctors, physicians. And we have nurse availability to the doctor or physician's proportion or ratio. It is just 2.2. 2 nurses are available. In Thailand, it is 7. Thailand is a very small country. Japan, it is more than 4. America, it is about 4. In South Africa, it is more than us, 2.1. We have 0.7. Again, this indicates that we are so much lagging behind in availing nurse facilities which are required. Very insignificant, very meager availability is there so far as the health sector is concerned. Now, what is important is health centers or hospitals, especially public hospitals. What is the availability and what change has taken place? Basically, public hospitals are divided into sub-centers, primary health centers and community health centers. Now, in availability, when a comparison is made from 2005 to 2018, you can see here graph, a little bit change is found. Little bit change is found. Primary health sector, health centers, a very meager change has taken place between the period 2005 to 2008. And more or less, very, very unsatisfactory situation in community health sectors. That is growth. Change means growth. Increase. Increase that has taken place is very meager in the number of hospitals categorized as sub-centers, categorized as public health centers, categorized as community health centers. That is an indicator that the availability of the public hospitals, public health centers is very acute. It is having a very acute shortage. And that is of crucial importance that is there. This talks about availability of health professionals, and allopathic doctors increases 24%, Ayush doctors availability is 9%, and nurses and pharmacists growth is 25%. But compared to the population, it is just inadequate. Now, this talks about the availability of beds to 1,000 population, and it is very meager. It is very insignificant. It is very insignificant, less than one to 1,000 population. Then this, what I wanted to place before you, about what is the health sector development in India, how the health sector of India is dominated by private sector, how the public sector is behind so far as health sector development is concerned, and how it is reverse, how it is contrast to the theory of health in economics, how it is just controversial. And availability of doctors, expenditure, then availability of nurses, availability of beds, that is inadequate and insufficient. And health status also I try to explain that is there. Now talking about COVID-19 pandemic, COVID-19 infection. First of all, I will try to place before you what trend is there in COVID-19 infection in India. And later on I will speak on what impact that COVID-19 has brought about on the health sector and healthcare services. Now, what is the present position? Today's position I am trying to place before you. So far as the total number of COVID-19 cases in India. total number of COVID-19 cases in India today are 5,48,318, of which 2,10,120 are active cases, 16,475 deaths have been taken place, and 3,21,723 cases have been cured. So far as the state-wise analysis or across the state analysis of COVID-19 cases infected in India is to be taken into account, it is found that Maharashtra is in leading position. Maximum number of cases or COVID-19 infected cases are in Maharashtra, and those are 1,64,626, which is followed by Delhi with 83,077 cases, Tamil Nadu 82,275 cases, Gujarat 31,320 cases, Uttar Pradesh 22,145 cases. But so far as the recovery rate is concerned, it is Gujarat is in leading position. Gujarat has 73% recovery rate, which is followed by Uttar Pradesh with 67% recovery rate. Then Delhi 63.32% recovery rate. Then Tamil Nadu 55.35 recovery rate, Maharashtra 52.59%. And these five states have contributed 70% of total number of COVID-19 infected cases. Now, further analysis of COVID infected cases with reference to India is to be taken into account. It is found that there are 10 metropolitan cities which are hit hard by the COVID-19 infection. Delhi is highest, previously it was Mumbai. Delhi is highest with 83,077 cases, Mumbai 75,539 cases, Chennai 53,762 cases, Thane 34,257 cases, Pune 20,870 cases, Ahmedabad 20,480 cases, Hyderabad 10,811 cases, Kolkata 5,573 cases, Palghar 5,267 cases, and Gurgaon 5,225 cases. Today in the world, total number of cases infected from COVID-19 are 10.28 million, of which 5,05,131 deaths have been taken place and 5.58 million cases have been recovered so far as the global scenario is concerned. Now, this talks about rising cases in India from the COVID-19 cases, and this graph talks about the cases from June 7 to till date, and it has a continuously rising trend. This also covers unlock period 1. Unlock 1 also covers. This indicates that the number of infected cases or cases infected from COVID-19 in India are continuously rising, are continuously increasing. Now, this is very important. All of us know that we adopted a policy of lockdown, and first, second, third, fourth lockdown today it will complete, and from tomorrow, fifth lockdown will continue. In the fourth, from 1st June, one unlock was also there. This graph shows how effective that lockdown policy is there. And you can see up to second lockdown, there was a control over the cases infected from COVID-19. But after the second lockdown completes, or it completed, a continuous rise in the cases infected from COVID-19 is found. That is, infected cases is increasing and active cases is increasing. This gap shows that the number of cases infected and the number of cases active, those are rising. And the same scenario that is being explained, is being indicated by this graph also in the post-lockdown period, especially after third lockdown, a continuous rise in total infected cases, total active cases that is taking place. What does this mean? This means that lockdown policy has become ineffective. It has not become effective. It is not efficient so far as controlling the total number of infected cases or infected from COVID-19 is concerned. Now, in this COVID-19, first of all, we have to identify the patient of COVID. And for that reason, it requires to conduct a test. And the testing facility which is available, what availability is there, that is necessary to be taken into account. Initially, the test being carried out, being done in India was just 802 to per million population initially. It was just 802 tests were taking place. In Iran was more, it is about 6,000. In Singapore, it is 24,600. In Japan, it is 1,449. Even the developing countries are taken into account. In Philippines, the number of tests conducted, it was more than 1,000. In Malaysia, it was 6,000. In Thailand, it was more than 3,000. In Sri Lanka, it was 1,200. But India had only 802. Now, a little bit improvement has taken place. Now, we are conducting 2,056 tests to 1 million population. But this ratio is significantly higher for other countries. In America, it is 43,000. In Russia, it is more than 57,000. In Germany, it is more than 52,000. In England, it is more than 49,000. Then in Spain, it is more than 64,000. That is, we are so much lagging behind in identifying COVID patient. Unless and until we identify a patient, we are not in a position to give treatment. And that is happening in the country like us. And consequently, the morbidity, that is number of cases infected, that is increasing. And we are not in a position to give treatment, which is necessary to be given whatever is available. Now, what is the profile of patient infected from COVID-19? Of the total patients, 76 are male and 24 are female. But the age group is taken into account. Age group is taken into account. Hello? Bola. It is to be taken into account. It is found that in the age group 40 to less than 40, it is 47%, and 40 to 60, it is 43%. And consequently, the deaths, those are taking place, that is also in the age group. Above 60, it is 8.9%, and 40 to 60 years, it is 2.4%. Now, this gives us an idea that how the health sector has been infected by COVID-19. Now, what measures we adopted? We adopted use of sanitizer, use of hand wash, use of safe distancing, use of face mask, social curfew, and lockdown. And this lockdown policy has very adversely affected health sector of India. So far as impact of this lockdown is concerned, the GDP has very significantly declined. Just I will cite some of the data. In financial year 2020, GDP growth rate has been declining very continuously. Now it is 3.1%. Then it is 3.1% just. Then World Bank Monetary has estimated India will grow at the rate of 1 lockdown period. And now what is important is, this is the GDP trend. This is the latest estimation of the GDP trend in India in the post-lockdown period. Lockdown policy and COVID-19 affected health sector. Some of these studies were carried out. Take example, Anand Kumar and others have carried out a study. And according to them, in rural areas, 65 to 68 percent population is staying, and it has created a threat to the country. In rural areas, there is a shortage of 18% sub-centers, 22% primary health centers, 30% community health centers. And the availability of the infrastructure and staff is inadequate. That is the conclusion that has been drawn. Availability of beds is low. Take example, in Uttar Pradesh, just 2.5 beds are available to 10,000 population. And in Rajasthan, it is 2.4 and 2003. Then in Maharashtra, the availability of beds is just 2 to 10,000 population. Shortage of specialists, that is surgeons, then gynecologists, physicians, pediatrics, their activity is inadequate. Then availability of human resource in the health sector is very inadequate. Then during COVID-19, the number of migrants labor are migrating from the working place to their native place. And this has created a problem of community transmission. And our health sector is not in a position to control that because of inadequate availability. Then health sector in India is very inadequate compared to the population that is available in India. Then quality and availability of the health sector, healthcare services is inadequate. Now, Soumya Swaminathan is a chief scientist in World Health Organization, and she says rural health sector or rural area will be a hotspot of COVID-19 infection because availability of the health sector and health resources inadequate. One more report is there relating to how this COVID-19 affected health sector of India. And this says because of this COVID-19, that revenue of the health institution has been declined. And prominently, the insurance benefit is not available to the poor section of the society, to the marginalized groups of the people. And prominently, they require to spend more from the out-of-pocket expenses. Again, FICCI also has brought out one report about the impact of COVID-19 on health sector. And it says that it has posed a double burden on the health sector. On the one hand, inadequate availability of the infrastructure, and on the other hand, the inadequate availability of the human resource that is there. Now, this means that health sector has been very adversely affected by COVID-19 pandemic, COVID-19 impact. Health sector is inadequate, private sector is dominated, staff is inadequate, then nurse facilities inadequate, and prominently private sector was initially not participating in giving healthcare services to the patients which were infected from the COVID-19, but later on private sector also participated. Unfortunately, the treatment to be given is in public infrastructure and health institutions, but the availability of the health infrastructure and institutions in public sector is very inadequate. Here I want to give some examples how health sector of India fell because of the impact of COVID-19. Take example in Mumbai, one doctor, he was giving treatment in ICU to the COVID-19 patient. His family was infected from COVID-19, all family members, and it became very difficult to recover from the case infected. In New Delhi, a doctor working in All India Institute of Medical Services, medical institution, his death took place because of COVID-19 infection, and he was the chief of ICU unit in that All India Institute of Medical Sciences. Number of deaths of police officials has been taken place. And one example is one pregnant woman wanted treatment, but she was not admitted because she was asked that do you have that COVID-19 infected certificate, and she lot of trouble she experienced during the COVID-19 cases, 19 infection. Now, when this is taken into account, but on the one hand, environment has been favorably affected by COVID-19. Air pollution has decreased, water pollution has decreased, noise pollution has decreased, and that also has helped to some extent in avoiding sickness. That is also necessary to be taken into account. Maharashtra, Mumbai, Pune environment has been purified. That is there. So as to tackle the problem of adverse impact on the health, Government of India has provided, in general, economic stimulus package. Reserve Bank of India has also announced some schemes, and some reforms are being carried out in India. And unfortunately, health sector is in privatization. The government desires in future as the part of reforms in health sector that is there. And the economic stimulus package the government of India has given to the total economy as a whole, which is just less than 1% of GDP, and it is significantly lesser compared to the foreign countries. That is for some micro, small, medium, then poor section, agricultural allied व्यक्ति, some financial provision was made, and particularly on health sector. On April 21, the government of India announced 15,000 crore rupees on health sector. Out of that, only 7,774 crore, that is 51%, were available. And in the next 4 year, remaining amount is going to avail. And out of the PM Care Fund, 7,774 crore, only 3,000 crore have been available, and that is available to the state governments, and part of that is allocated to the health diagnostic facilities being developed. In this backdrop, moving towards my last part of lecture, that is what policy is required to be taken by the government of India so far as reducing, controlling adverse impact of COVID-19 on the health sector is concerned. The policy measures can be divided into two parts. One is immediate and short-term policies are required, and long-term policies are required. In the short-term policy, that health services should be given a status of social good or social service, and government should take a responsibility, and more budgetary provision of expenditure is necessary to be made in the budget that is required. There is an urgent need of increasing staff, their security and their protection. And prominently, health sector in rural India is necessary to be developed very rigorously and sincerely. Training, education and awareness among the people is very much urgently needed. And in the long run, a significant health sector infrastructure development should be given a priority, it should be given a more importance. And in that direction, the efforts are required. There is a need for public and private sector coordination, because actually health sector should be public, but we have private sector as a dominant, and no coordination is there between public and private. Nowadays, or in the coming future, there is a need for public and private coordination in the health sector. In addition to that, coordination among union government, state government, and local government is very much required. We should have a plan for unexpected pandemics like COVID-19. In future also, some pandemics can emerge out. We cannot forecast, we cannot predict, and their planning is required, their preparation is required. And for environmental preservation, conservation, one day in a week, lockdown can be adopted that can help us in environmental conservation, prevention, protection. That can also help us in improving health condition. In this direction, there is a need for undertaking efforts divided into short run and long run that can help us in reducing, controlling and regulating adverse impact of COVID-19 on health sector and the sufferings of the people because of COVID-19. Last but not the least, thank you one and all. Thank you very much. Thank you very much.
Thank you so much, sir.
Okay.
Thank you so much, sir.
Okay.
Sir,
Thank you. Thank you very much. Thank you.
Sir, your talk has been really valuable. The insights that you have given on the issue of impact of COVID-19 on health is going to benefit all the participants in a long run very much. Thank you so much, sir.
Thank you very much. It's my pleasure. Thank you very much.
Okay. Friends, now we move on to the second session of the day. The next resource person, Dr. D.H. Pawar sir, is ready. In just a short, we will start with the next session. Thank you so much. Friends, let's start with the next session. First, I would like to request Dr. R.S. Shikalgar sir to introduce our esteemed resource person, Dr. D.H. Pawar sir. Shikalgar sir, please.
ओके आवाज येतोय सर
Yes, आवाज येतोय sir.
गुड आफ्टरनून टू एव्हरीवन इट इज अ ग्रेट प्लेजर फॉर मी टू इंट्रोड्यूस आवर स्पीकर्स for this session, Dr. D.H. Pawar sir, who is going to talk to us about the impact of COVID-19 on Indian tourism. Our speaker is currently serving as an associate professor in the Department of Geography, Shivaji University, Kolhapur. He is also coordinator of Tourism and Travel Facility Center, Shivaji University, Kolhapur. His specialization is geomorphology and environmental geography. He has total teaching experience of 22 years. He has authored 4 books. He has published 56 research papers and presented 78 papers at national and international level. He has attended more than 100 workshops, seminars, and conferences. Sir has guided 8 students for PhD and 12 students for MPhil. He has assessed more than 45 PhD theses. He is a life member of various academic bodies and societies and has also worked as a resource person to various academic institutes. He has given valuable contribution in Marathi Vishwakosh. We are really lucky to have respected sir as our resource person for this session. Thank you very much.
Thank you so much, sir. In just a bit, our resource person, Dr. D.H. Pawar sir, will start his talk. Thank you.
Hello friends, I am very much happy to be here to have an online discourse with you all. At the outset, I thank Dr. Anna Sahib Khimnar sir, Principal, Government of Maharashtra's Rajaram College, Kolhapur. I also thank convener, co-convener, and members of organizing committee for inviting me in this national seminar on impact of COVID-19 on India with respect to health, tourism, agriculture, and geopolitics. Friends, from the last 3.5 months, we are unfortunately experiencing complete and partial lockdown of all our day-to-day social, economical, cultural, businesses of all aspects of our life. We are experiencing unprecedented standstill of life. Friends, we are all almost stopped. Who is responsible for this situation? Of course, worldwide outbreak of coronavirus, that is latter named as a COVID-19 by World Health Organization. The contamination of COVID-19 in human has restricted the physical meeting and gathering of people. Friends, this dreaded pandemic COVID-19 has brought all aspects of human life under its bad influence. COVID-19 has upside down the economy, agriculture, health, transportation, entertainment, communication, geopolitics, culture, and customs, and all other aspects of life. Friends, focusing on our topic, that is the impact of COVID-19 on tourism sector, is one of the worst COVID-19 affected aspect of human society. Tourism activity worldwide has hit hard with lockdown, loss of millions of jobs, this host economy. Friends, worldwide tourism sector can lose enormously by 60 to 80% decline by the end of this year. It will result the revenue loss of 910 billion American dollar to 1.2 trillion American dollars. In the month of March, there was a drop of 57% international tourists worldwide due to the beginning of lockdowns in many countries. By the March, there were closure of airports and national borders and beginning of travel restrictions. By the month of April this year, there was worldwide loss of 67 million arrivals and about $80 billion direct received from international tourism sector. In coming months of year 2020, there will be 58 to 78% of decline of international tourist arrival in the world. Of course, it is depends on the rate of contamination and the duration of travel restrictions in the respective countries. By the end of December 2020, there will be a loss of 100 to 120 million jobs in the tourism sector globally. This will put tourism 10 years back in its sustainability. However, United Nations World Tourism Organization panel of experts pointed out that domestic tourism will recover faster than that of international tourism in respective countries. Now, if we see the travel restrictions, according to UNWTO, that is United Nations World Tourism Organization's report, by the April 20, 100% of all worldwide destinations have already introduced travel restrictions. 97 destinations, that is 45%, have totally or partially closed their borders for tourists and other passengers. 65 destinations, that is 30%, have suspended totally or partially their international flights. Friends, 39 destinations, that is 18%, have closed their border for passengers from specific countries of origin. They have Thank you very much. If we see the geographical region, that is Asia and the Pacific, this region was the first hit in arrivals in the first quarter of 2020. The second hardest hit was Europe with a 19% decline in the international tourist arrivals, followed by the Americas 15%, Africa 12%, and the Middle East 11% decline in the international tourist arrival. In this map, this Asia Pacific region, where you can see the China, Japan, and other these countries, where tourist destinations are very famous. In the 2019, there were 316 million tourists. They have visited the places. That is, in the first quarter of 2020, is declined to 35%, such as in the region of Africa, Europe, America, the Middle East. We can see here. In the totality of the world, in 2019, there were 1.5 billion passengers, international tourist arrivals have been observed. In the first quarter of 2020, there was a decline of 22% international tourist arrival in the entire world. Here in this graph, we can see that international tourist arrival, the month-wise, where in the world, in the month of January, there was a increase, a 2% increase, whereas in the month of February, there was a decline of 9%, and it is again plunged down to 57% international tourist arrival. Here we can also see the Asia and the Pacific. In this region, the COVID-19 has emerged in the month of December. So therefore, they have started their lockdown in the month of December. So therefore, January, February, and March, in all months, we can observe here the decline, the rapid decline of the international tourist arrivals. Whereas in America, Africa, Middle East, and Europe, they have started their lockdown very late. So therefore, we can observe here in the month of January and February, there is an increase in the international tourist arrival, whereas there is a rapid decline in the month of March of international tourist arrival. Now, if we see the travel and tourism sector in India, the status of travel and tourism, before going to the impact of COVID-19 on tourism in India particularly, in the year 2018, travel and tourism contributed 9.2% in India's GDP. The travel and tourism sector generated 26.7 million jobs in cities and rural areas. This sector provided 12.75% of employment, direct and indirectly. Over 87 million people were employed in the tourism and travel sector in 2018-19. It is categorized and organized hotels. Annual revenue is a 38,000 crore, that is equal to 5 billion American dollars. The restaurant industry in India has annual turnover is approximately 4 lakh crore, that is $53 billion, which provide employment to more than 7 million people. Air transport industry in India employs over 4 lakh people directly and 9 lakh 40,000 are employed in a related supply chains. India's total foreign tourist arrivals, it stood at 10.9 million and the foreign exchange earnings stood at rupees 2 lakh 11,000 crore during 2019. Here, the Maharashtra, Tamil Nadu, Uttar Pradesh, and Delhi accounting a major contribution in the foreign tourist arrivals as a 60%. The impact of COVID-19 on tourism sector in India, if we see, there is a revenue loss of rupees 1.25 trillion in 2020 due to the shutdown of hotels and suspension in flight operation. It is corresponds to a 40% decline in revenue in year 2019. The impact of the pandemic on tourism was about 50% during January and February 2020, while it was higher as much as 70% in March alone due to the suspension of international flights. During April to June, here we can see the loss of revenue of 6. So aviation industry in India could incur the losses of worth of 27,000 crore, that is 3.3 to 3.6 billion dollars in the first quarter of 2020-21. The passenger growth of airline is likely to fall sharply to negative 20 to 25% growth for the 2020 to 21. Indian Association of Tour Operators, they have estimated $85 billion, 85 billion loss of rupees because of the hotel, aviation, and travel sector. Immediate impact of COVID-19 is seen in the hotel segment. Inbound, outbound, domestic, and all other components, that is leisure, tourism, adventure tourism, heritage, conferences, exhibitions, businesses, cruise and corporate activities, they are all halted because of the impact of COVID-19. The restaurant industry in India is at a zero revenue in the immediate term and is a drop of 50% in the month to come in this year. There is a threat of job loss of nearly 15% in the hotel and restaurant industry, and it is once the lockdown is lifted, they will not be seeing an immediate surge in the demand. Due to the travel restrictions, bookings for various conferences, foreign national destinations have already been cancelled. In India, most of the summer holidays bookings for the state of Kerala, Rajasthan, Goa have also been cancelled. Thereby, this is impacting the domestic tourism very heavily. India's total foreign tourist arrival, that is FTA, stood at 10.9 million and the foreign exchange earnings stood at rupees 2.11 lakh crore during 2019. With Maharashtra, Tamil Nadu, Uttar Pradesh, and Delhi, they are accounting for about 60% of foreign tourist arrivals. However, now with travel restrictions in India for over 80 countries and most of the flights of major airlines had suspended, along with the lockdown till June 30 this year. The Indian domestic as well as the foreign travels and tourism industry is expected to witness a sharp negative impact in the 2020. Now, the revival of tourism, if we see, the if we see how this is going to be improved, we have to revive the tourism in India. So we have to take some sound steps. Restructuring tourism, the restarting tourism, then tourism recovery, travel restrictions, recommendation of action, then tourism recovery packages. In the restructuring tourism, we have to rethink on the system of booking, hospitality, destination visit, and tourism recovery. We have to attract the tourists, so we have to implement the physical distancing for the travel restrictions. We have to follow the government norms. In the case of tourism recovery packages, financial support, tax exemptions, counseling, technical support, medical assistance, we have to provide to the tourists. The priorities of recovering the tourism, we have to focus on domestic tourism than that of international tourism. Because World Trade Tourism Organization, they have stated that the domestic tourism is going to revive earlier and fast than that of international tourism in respective countries. We have to provide liquidity and protected jobs. We have to protect jobs in the tourism sector. We have to provide, we have to pay them during the lockdown period. We have to recover confidence through safety and security. The public and private collaboration for an efficient reopening is also needed to revive the tourism sector in India. We have to open borders with responsibility for the safe of tourists. Harmonize and coordinate protocols and procedures. Added value jobs and through the new technologies, innovations and sustainability as the new norms. If we say here, World Tourism Organizations, they have stated that international tourism and domestic demand of tourists by the May to June, there will be a 3% demand in the international, whereas 14% demand in a domestic tourism. By July to September of this year, there will be a 24% international demand of tourists, and 45% will be observed in the domestic demand of tourism. By October, December, it is slow down, that is 34%, because here we can see that international demand of tourists has increased by 34% and domestic is a decline, that is only observing 25%. By the 2021, the international tourism will be increased 39% than that of domestic demand of tourism. Here, United Nations World Tourism Organization, they have stated a model of starting a safe tourism. The first is safe and seamless border management. That is the safe air, sea, and ground level journey. Then cost-cutting measures for private sector, tourism, and then safe air travel, the hospitality, tour operators and travel agencies, meetings and events, then attraction and thematic parks, then the destination planning and management. If we see here the safe and smooth tourism, first the search and book. As we have started to search the destination to visit on health requirements and procedures from origin country, travel providers and destinations, information on cancellation and policies if sick while traveling or at the destination, then sharing this data at the national tracing apps. You can see that. The second step, that is leaving home, the contactless payments in local transportation, the physical distancing rules, then have to follow the protocols in place at local transportation. Then on our destination, it is the limit carry-on baggage that would require on the overhead bins. Then the contactless border control when we are going outside our country. Operation of transportation infrastructure and operations adapted to physical distancing and health regulations in place. On the way, advanced contactless check-in and boarding at our pre-allocated seat. Limit carry-on baggage that would require use of the overhead bins. Then contactless border control when we are going outside our country. Operation of transportation infrastructure and operations adapted to physical distancing and health regulations in the place. We see here this private sector cost-cutting measures. We communicate protocols and responsibilities to the customers and keep them informed on site and through digital and social media. We have to clean all surfaces more frequently using product and disinfectant that meet requirements with special attention to high-touch surfaces. Set up a plan in the event a guest or employee falls ill on site. Create an internal and limit the movement within the cabin during the flight. Redesigning the processes towards more digital touchless operations in all possible touch points. We have to keep record of statistical information for tourism planning and management. If we see here, health check procedure as appropriate according to the risk assessment, increase the frequency of aircraft and cabin cleaning, providing masks for passengers and crew and ensuring their use during the whole flight. Implement boarding and deplaning processes that reduce contact with other passengers or crew in respect of physical distancing rules. Limit movement within the cabin during flight. Simplify catering and other procedures. Facilities people not sitting next to each other. And provide in-flight sanitization tissues to passengers and crew members. Reduce the number of objects in the cabin and limit hand baggage. Yeah, we have to increase the frequency of cleaning in the common areas and contact surfaces. We have to inform guests about existing protocols in an easy and updated manner. Explore new methods such as electrostatic sprays, ultraviolet lights, etc. Implement contactless check-in and provide guests with a hygiene welcome kit. It is including gloves, masks, and sanitizers. Know more about your guests in advance to the arrival to provide a more personalized service. We have to keep spare rooms for possible sick or quarantine guests. We have to keep physical distancing for the use of all common spaces. Use technology for messaging for reservations, refunds, cancellations, or possible information about infections. We have to create positions to control all these facility as a hygiene manager and guest guardian. Destinations. If we visit destinations, it encourages the use of mask, face covering for guests and staff. But to reduce the touch areas where possible and sanitize high-touch surfaces frequently. We have to protect employees with various approaches, including barriers, protective coverings, and distancing. We have to manage the density of people at common spaces, reduce or manage capacity to maintain physical distancing within the space. We have to place signs or markings of the pavement to outline physical distancing guides and spaces. We have to encourage online payments and pre-bookings. We also have to implement new technologies such as augmented reality or virtual reality to improve visitors' experience before, during, and after visit of tour. Here, the World Tourism Organization has one model to visit the countries on the categorization of the destination countries according to the degree of contamination of COVID-19, that is safest, less safe, and restricted. This traffic light system for the tourist, it tells us about the green zone where the Australia, Barbados, Croatia, Germany, New Zealand, Greece, Thailand, and Vietnam, these countries are counted as safe for visitors. In the amber zone, where the countries like Australia, Belgium, Canada, Denmark, France, Italy, Japan, Netherlands, Portugal, Singapore, South Korea, Switzerland, and Spain, they are categorized as the less safest. It means that tourists are informed that they have to take utmost care visiting these countries. And there is a red zone where total restrictions have been declared. These countries are Argentina, Brazil, Chile, Colombia, Egypt, India, Israel, Mexico, Morocco, South Africa, and the United States of America, where the total ban or total restricted area for the visiting tourists. In this map, we can see here, this is no quarantine zone in the green color, where there are some countries like Australia, Barbados, Croatia, Germany, New Zealand. There are, you can see in the next zone, there's the amber. We say there is no quarantine, but at a risk of restrictions being introduced here in these countries or in these geographical regions. And this red zone denotes where the infection of COVID-19, contamination of COVID-19 is very severe, where 14-day quarantine is essential. This recovering tourism, why we should recover the tourism? Because there is a need of our to recover tourism immediately, because the need of tourism here because tourism contributed directly and indirectly to the global job creation and economic recovery. Tourism has the capacity to bounce back strongly and quickly after the crisis. Tourism, it is mitigating the impact of the crisis, and stimulating tourism recovery can pay massive returns across the whole economy. Tourism facilitate cultural exchange, mutual understanding, and peace within the society and within the countries also. The most recent measures which has been taken place for restarting tourism in the world, they are adopted by Europe, then Asia and the Pacific. Across all regions, there has been a strong and widespread policy response to the impact of COVID-19 pandemic. Here, World Tourism Organization, they have studied 220 countries and territories, out of which 167 countries have reported specific measures to mitigate the effect of the crisis and accelerate recovery. Among them, more than 144 countries, they already have adopted fiscal and monetary policies, followed by some policies to support jobs and training in the tourism sector, which have been implemented by 100 countries. Fiscal and monetary policies are also the most popular in all these regions. So, with this, I would like to conclude here. I am very much thankful to the organizer for inviting me in this two-day national seminar. Thank you very much.
Thank you so much, sir, for your valuable guidance on the topic. Today's both speakers, Prakash Kamble sir as well as Pawar sir, have given us insight into two important dimensions which have got affected because of COVID-19. I am really thankful to both these speakers. Now I call upon our head of the sociology department, VM Ingole Madam, to propose vote of thanks. Ingole Madam, please.
Namaskar. As all good things. Hello. Namaskar. As all good things come to an end in the life, the COVID-19 too will end. But right now is the time. Second session of National Seminar on Impact of COVID-19 on India, Health, Tourism, Agriculture and Geopolitics organized by IQAC and Department of Social Sciences. On behalf of Rajaram College and organizing committee of National Seminar, I, Vidya Ingole, take this opportunity to propose vote of thanks to all who have directly, indirectly contributed to this seminar. I thank respected Dr. P.S. Kamble, Professor, Department of Economics, Shivaji University, Kolhapur, and our resource person of first session for his valuable guidance on topic Impact of COVID-19 on health. I also thank respected Dr. D.H. Pawar, sir, Associate Professor, Department of Geography, Shivaji University, Kolhapur, our resource person of today's second session. He guided us on topic Impact of COVID-19 on Indian tourism. His guidance is valuable and helpful for us. I would like to thank our principal for his enthusiastic support. A special thanks to you all participants for active participation. Also want to thank organizing committee, teaching and non-teaching staff for their support and coordination. With these warm words and a kind message, we move to the end of today's session. Thank you. Have a nice day.
Thank you so much, madam. With this, we come to an end of today's both the sessions. Tomorrow again we will meet at 11 a.m. And tomorrow we will be having two more sessions. After those sessions, a feedback form link will be shared to all the participants, and I request all of them to fill up at that time. Thank you for everyone to join. Thank you. Have a good day. Again.